The armed forces have a new unexpected enemy to fight: COVID-19. EU defence ministers met to assess the bloc's ability to respond to the pandemic. From building hospitals to transporting medical equipment, defence services have been key in battling the outbreak. But according to some experts, cooperation between countries needs more thought.
The European Union is not at all ready. The coronavirus has shown that it is ultimately everyone for himself. Some countries asked other European countries for help and never received it. And we see that Europe has been totally absent in the fight against the coronavirus, that we have fallen back on purely national powers and policies.
The EU has launched a task force that helped mobilise some national armies to transport patients and medical supplies from one country to another within the bloc. The final aim is to strengthen the EU's resilience to infectious diseases, even in the case of a hypothetical biological attack. And that will require funding from the next EU budget.
I hope that in this scenario, the resources allocated to the defense and security policy will not diminish, because I said before, the coronavirus has brought a new threat, and it requires a stronger defense and security policy, a stronger Europe in the world.
Beyond defence, easy access to medicines and medical equipment is key to security, as supply chains can easily be interrupted. Europe needs to increase production and storage capacity of medical essentials. Brussels has sought to do this via joint purchase orders.
The degree of globalization that we have at the moment with international delivery chains, where basically 90% of the masks, for example, are being produced in China, is something we need to reconsider, and we need to carefully assess what the important equipment, the important tools, the important industries, and the crucial industries are that we actually should also have within the European Union, to make sure that once the global delivery chains break down again, we are not as vulnerable as we have been this time.
Overall, lessons must be learned from this crisis now that health is a security issue, because the next pandemic should not catch the EU off guard again.